and thank you all for attending this very momentous gathering. It's not every day we have such a wonderful award and even have the honoree present with us. So I think that makes it a particularly special occasion. I do want to thank all the reviewers whose expertise and careful consideration were invaluable this year to select an award member. I also want to thank the 10 groups and individuals who were nominated. It was an extremely tough choice this year, but I think that the selection process was really rigorous and reflect the high quality of work and submissions that we had. The Bonnie Strickland Champion for Children's Vision Award, as you know, recognizes significant efforts by an individual or a group to improve public health approaches for children's vision and eye health. The award has fairly comprehensive and rigorous criteria, and nominees and organizations are challenged to demonstrate an impact in multiple areas of population health systems. So stakeholder engagement, training and education, public awareness, provision of resources, surveillance, reducing health inequities, and connecting vision to overall health. So it was really wonderful to see all of the submissions and all the creative and really rewarding work that's being done. And the awardees should take great pride in their reception of this award. Their submission really reflected broad and deep work that connected to a lot of these elements of population health. And we were just so honored to have representatives with us from iThrive. And I just really want to extend my congratulations and say how exciting it is to see you here, because we were really impressed reading your application.
Thank you.
Thank you. Thank you.
Thank you so much. And I'm just going to share my slides for a moment. So I'm Donna Fishman. I'm the director of the National Center for Children's Vision and Eye Health. We are very lucky tonight. We have the namesake for the award with us this evening. I'm gonna stop sharing so we can all see each other. Dr. Bonnie Strickland herself is here tonight, and we are so lucky. This award was named after Dr. Strickland to honor her for her groundbreaking work to establish a comprehensive system for children's vision eye health in the United States. She was the director of I want to make sure I say it right. She was the director of the Division of Services for Children with Special Needs in the Maternal and Child Health Bureau before her retirement in 2014. And she's so smiling and happy because now it's like almost 12 years that she's been retired.
Yeah.
And she comes back most every year and is with us during this event. So we asked her if she would just give a brief hello. So thanks, Dr. Strickland.
Hello. And as I've said before, I'm still just humbled and honored that this award bears my name, and more so every single year. But I should also say, I mean, I was the director of the program at the time. There were so many people behind this work for so many years. Marie Mann, who's on the call, being one of them, Michelle Perrier, the staff of the Genetic Services Branch, the Integrated Services Branch. So there was a whole host of people really, really committed to this long before I became the director of the program. But what I was able to spearhead was the National Center many years ago, and I will never ever forget that. You know, sometimes the stars are just don't seem to be aligned, and I think that was a time when they were. We were able to demonstrate a national issue. We had leadership that wanted to commit to doing this. We had the capacity to do it, and we had Prevent Blindness out there ready to take on the job. And I was certainly never ever disappointed. One of the best investments I think the Bureau made. I know Marie would probably say the same thing. And I'm not able to thank you on behalf of the Bureau. Maybe Marie can speak on behalf of the Bureau. Who knows who's speaking on anybody's behalf these days? But But I do know that the Maternal and Child Health Bureau was proud to be the funder of this work over the years, and absolutely has not been disappointed. It's been money well spent. I'm not going to say anything else. I've already said to iThrive staff, and this is an amazing program, not for screening, but for eye care, ongoing, comprehensive follow-up eye care. I can't believe you can make a pair of glasses in 30 minutes. It just blows me away when I go to Costco and have to wait weeks and months for my glasses. But and the replacement strategy that you have, and your partners, there's just not a weakness that I can see in this program. And I look closely at sustainability, because a lot of things get off the ground but can't stay off the ground and be effective year after year after year. So, and I think that, looking at your partners, you've really addressed that problem. So I'm not, other than to say thank you again, and to quote what I read on your website, what a difference a pair of glasses can make. And it's so true. So very true. And I'm looking forward to hearing more this evening.
Oh, thank you so much, Dr. Strickland. That was really beautiful. And we were really proud that we were recipient of funds from the Maternal and Child Health Bureau for 12 years. And it really helped to set the course of the center. And we're happy we're continuing now. So I'm going to turn the program over now to Stephanie Klass, who's going to be presenting the award.
Hi, everybody. Good evening. So I'm Stephanie. I'm from the National Center for Children's Vision and Eye Health Advisory Committee at Prevent Blindness. And I'm also a parent of 2 young adults now, no longer children, with vision impairments. And tonight I am just so honored to introduce the winner of the 2025 Bonnie Strickland Champion for Children's Vision Award to iThrive. So iThrive operates in the St. Louis metropolitan area, and its primary goal is to ensure clear vision and healthy eyes for low-income children through their comprehensive wraparound services, and that they're going to tell you about a little bit more in a few minutes. So among an extremely competitive field of applicants, like you've already heard, iThrive and its comprehensive nature of their program really stood out to us. And I just wanted to touch on a few of the reasons that they're being honored tonight. First of all, the number of children reached by their programs. For example, during the 2024-2025 school year, iThrive screened 17,747 children, and they provided 4,789 comprehensive eye exams. iThrive has a growth mindset. So through their strategic planning, they deployed a second mobile clinic this year, hoping to double their impact. iThrive programs meet or exceed the National Pediatric Vision Guidelines, and all their screeners are certified through the National Center for Children's Vision and Eye Health. They adhere to Prevent Blindness's best practice and policy recommendations, including protocols for children with special needs, their proper documentation, effective communication, and the follow-up. The establishment of the electronic medical record systems that they use is especially notable and ensures continuity of care and sustainability, which obviously are extremely important. The importance of their family outreach and education is also prioritized. So when children receive glasses, they go home with educational materials for their families and for them. When children are referred to medical care, parent follow-up and assistance is provided, especially with help navigating Medicaid or insurance issues. Community outreach is also prioritized, as evidenced by iThrive's annual community health fair, where they strengthen their bond with other community health providers. iThrive strives to continually address the importance of racial inequities in healthcare. All their staff receive training for trauma-informed care and cultural competency. iThrive has partnerships with over 100 high-need schools and community centers. They monitor data and demographics to target zip codes where barriers to access are more critical. And being a mobile provider also addresses major access barriers such as cost, time off from work, transportation, mistrust, and system complexities. I Thrive has a parent caregiver youth advisory board, which makes sure that their community and client voices are prioritized and their community bonds are strengthened, and it allows them to make sure their services are always evaluated and improved. I know you're all excited to learn more about this important program and all of their exceptional work. So on behalf of the National Center for Children's Vision and Eye Health, it is an incredible honor to present I Thrive with the 2025 Bonnie Strickland Champion for Children's Vision Award. And accepting the award tonight are Kate McKern, Chief Executive Officer, and Brandon Hinkle, the Senior External Optics Coordinator. Once again, congratulations.
Wow.
Wow.
Thank you. Thank you, Stephanie. I don't know if I don't know if we need to present now. You've really explained it all. But we are just so honored to be with you all this evening. And thank you again for that lovely introduction. And on behalf of all of us at I Thrive, we have a watch party going on. Thank you for this honor. Thank you to the National Center for Children's Vision and Eye Health. And of course, thank you to Bonnie Strickland Champion for Children's Vision Award Committee for selecting us. We are just so proud to stand alongside so many past recipients who share this commitment to children's vision health. And while our whole team is again incredibly grateful for this award, the award is truly about our kids, right? Our kids who constantly remind us the impact that a simple pair of glasses can bring. So we would like to start our presentation today with the way we start every meeting at I Thrive, and that is with a mission moment. So we're going to introduce you to Jalen. Jalen, at the time of the video, was a pre-K kiddo in Hazelwood, and this is the moment she received her very first pair of glasses. But you can see it was more than just the pair of glasses. It was the moment her world really, truly changed. She could finally see those details that we all probably take for granted. And this is the impact of I Thrive.
Yes.
Truly.
Yes.
So on that note, we should probably introduce ourselves a little bit more. Again, my name is Kate McKern, and I am just so honored to join you all tonight. I have spent my career working to make sure more kids get the care and support that they need, whether it be in the classroom or in an eye exam chair. And I am so proud to lead this incredible team and continue to advance I Thrive's mission over the last 9 years.
And yes, I'm Brandon Hinkle. I'm the external optical coordinator. I've been with I Thrive for now it's 4.5 years. It'll be 5 years in February. So, but I started my career in the optical world and started in lens crafters back in 2019, and then I transitioned over here in 2021. I learned about the mission behind the organization. I come from a household with a single mother household, so not having everything we need, I kind of understand the story, right? And so once I learned the mission behind what we do at I Thrive, giving kids free eye exams and free glasses, I've been embedded into the mission. I can't wait to see what is still yet to come with the years we got ahead of us. So who are we?
Who are we? Who are we at I Thrive? Well, our mission is very simple. We give kids the ability to thrive through access to essential vision services. We've been in the nonprofit sector for more than 20 years now. We were founded in 2004 by Bill Jaling, who was the president of Clarkson Eye Care at the time. And after he really founded this after he saw the need firsthand. And this started with one of his son's friends who was hanging out on a Saturday, and he noticed that his son's friend couldn't see the TV screen very well. And so they jumped into the car. He drove him over to Clarkson. He got the exam, and it turned out he did need glasses. And Bill was able to witness that moment of his friend's son, or his son's friend, putting on his glasses for the first time and the impact that they had. So then he naturally started to think about how many other kids might also be without the glasses they need, and then was innovative enough to dream up this program, and then we were born. And now 21 years later, we have provided more than 40,000 comprehensive eye exams and dispensed more than 40,000 pairs of prescription glasses on board our mobile vision clinic.
Yes, yes. So the need that we see. So Missouri no longer requires vision screenings in schools. This is something that we do at iThrive. In addition to give out eye exams and glasses, we also provide vision screening in our schools. On average, 38 kids fail their vision screening. So that tells us eye exams are needed. This is 13% higher than the national average. So what this tells us is our services is crucial for our kids in our communities.
Okay.
So let's go into our wraparound services.
Yeah. So what are these wraparound services that you've heard a little bit about? These are all designed. This is a model that was designed to remove the barriers that too often stand in the way of kids getting the glasses they need. Barriers like cost, time off of work, transportation, mistrust, and system complexities. And this entire model starts with partnerships. We currently have partnerships with more than 100 high-need schools and community centers across the region. And this model was very intentionally designed to be led by a single iThrive point of contact. Several of our school partnership coordinators are with us tonight, and this is the work that they lead. And it's a model that has proven to foster bonds, not only with our school nurses, but also relationships with our kids and families who feel safe and comfortable throughout the entire process. And once those partnerships are established, that's when the screenings begin. We again identify who needs the eye exam, and these screenings are led by that same single point of contact, who, as mentioned earlier, are all certified vision screeners through the National Center for Children's Vision and Eye Health. The screenings are designed to be minimally disruptive and are completed right outside the classroom door. From there, any student who has failed or not passed their vision screening is eligible to come on board our clinic. We usually follow up about 4 to 6 weeks after those screenings, and we return, and Brandon is often driving our 38-foot mobile vision clinic, where we provide comprehensive eye exams to evaluate the whole health of the eye. And I think there's enough people in the optical world in this call or in this meeting tonight to know how important that comprehensive part of the exam is. We dilate as needed, and we're really looking at the whole health of the eye, because while it's really important to identify each child's prescription, it's also important to be able to detect other diseases.
And then we get into what I believe is the fun part. All of this is fun part, but to me, especially glasses made on site. So we have a vision board, we have a frame board, with all of our frames are donated by DSP. But with the frame board, we like to give the kids the empowerment to choose their own frames. We want to empower them to choose what they like. And so if they find the frames that they like, they are likely going to wear them. So we have a famous frame board. Once the kids leave the frame board, then they come to the lab. And this is where the instant impact really happens, right? So kids come on board, a lot of times, if they never wore glasses or haven't worn glasses in a while, they think what they see is normal. But once they get a pair of glasses and see the corrected vision, their whole world changes. I'm gonna get into that more in the story later, but that's where the magic happens. We also, Kate talked about our referral program. We do have a referral program. We refer patients out to 2 different providers, UMSL and WashU. UMSL is we send patients that need more eye therapy to UMSL. If they need surgical base, then we send them to WashU. A couple of strabismus and amblyopia, a couple of diagnoses that we see are most common with the kids that we see. I do the follow-up. I call the nurses and the parents to make sure that they are in line and get those appointments met. We do about 4 to 6 to 8 week follow-ups. So I make sure that the parents get in there because we want the child to get the extra need that they need, right? Then we also have the replacement program. This is something I'm crazy about because we dealing with children ages 4 to 18, so we know likely they're either going to break or lose their glasses. That's just a common thing, right? So We replace the glasses as many times over the course of a year, no questions asked. This is why we want our kids, we want to make sure our kids are thriving in school. So we want to make sure they have those glasses they need so they can be supported. So let's get into the NBC walkthrough.
Hopefully this works. But we'd love for you to climb on board our clinic. And Bonnie was able to do this. I'm sorry, Donna was able to do this in person last week. But this is our mobile vision clinic. So 38 feet. We're going to kind of go a little out of order. You walk on board, and this is that frame board that we were talking about. Over here is our pre-test area, followed by the front exam lane, which is a fully equipped optometry exam lane, just like you would see in a regular optical shop. We have our second exam lane in the back. A little bit more spacious.
We call that the suite.
And then right here is where the magic happens, like Brandon was saying. This is our lab. This is where Brandon or another staff member makes those glasses right there on the spot.
And so I want to get to the next story. This is Aiden Humphrey. He's one of our kids at our Collinsville school. Aiden first seen us when he was in kindergarten. He never had an eye exam. He never wore glasses. So he comes on board and he goes through the process. He goes through the pre-test, goes through the exam. He goes through the frame board to pick out his frames. And when I received his glasses in the lab, I looked at his prescription and I asked him, I said, Aiden, have you ever wore glasses before? He said, no, sir. And I said, wow, this is about to change your life. The reason why, he was a -5 in both eyes. Never wore glasses before. So I put the glasses on him and he couldn't stop smiling from ear to ear. It literally made me want to cry. I mean, he hopped off board. He saw the trees in a new way, the leaves and the grass in a new way. It really changed his life. And now we see Aiden every year in Collinsville. We are his eye vision providers. So this is just another one of the stories of how we're changing lives on a daily basis, right? I can't wait to see him this year. Equity and impact. So go ahead. Because we serve children in the clinical settings, this is often his first time. This is their first time often having a healthcare experience, right? We prioritize trauma-informed care. Our team is trained to recognize and appropriately respond to trauma, ensuring that every kid feels safe and respected during the visit. Most of our students on board are from minority or low-income families. So we do these trainings throughout the year multiple times. Next, and you guys spoke to it already, our 2 MVCs. We understand the unmet vision need in our community, right? So this June is when we launched our second MVC so we could double our impact and double our reach. We have now 2 fully equipped optometry centers on wheels traveling across 9 different counties in the St. Louis metropolitan region. And we're looking to get more later.
Exactly. But you know, the numbers really speak for themselves. They were mentioned earlier today. Just last year, we provided more than 17,000 vision screenings, nearly 5,000 comprehensive eye exams, and we dispensed more than 8,000 pairs of glasses, either on the clinic or through replacement glasses. And that was just with one clinic. And while those numbers are important, we know that the real change is measured by the impact glasses can have on our kids' lives. And we've talked about some stories of success, but we also measure this through our multiple surveys. And we wanted to zero in on one survey in particular, and that's the parent survey, where 100% of parents report an improvement in their child's self-esteem. Think about how important that is, especially now. 86% of parents report improvement in attention to their surroundings, meaning they can safely navigate their world, they can cross the street safely. And 100% report an improvement in their engagement in some sort of outdoor activity or sport. Again, very important to the growth and development of a child. And the best part is that this impact happens year over year over year. I think there's often a misconception in the mobile health world that mobile health services, or maybe not the mobile health world, but just the world, that mobile health services are a one and done. But that's the exact opposite of what we're doing at iThrive. We see kids like Jalen and Aiden year after year from pre-K all the way through senior year. And as we've mentioned, we really have become their trusted eye care provider. And one of the reasons we can do this is because of our custom-built EMR, electronic medical record system, that tracks each of our child's care and medical information over time, ensuring a real continuity of care. And one of our major partners that has supported this initiative, Mid-America Transplant Foundation, is with us today at our watch party. So big shout out to them for helping make this project possible. An example of this in action is actually Gus, the kiddo you see here. Every summer, Gus travels to find us. Doesn't matter where we are, we always see him every summer. And his mom has shared that he's actually been to the traditional brick and mortar optometrist. But his mom continues to choose iThrive because of the high quality experience and trusted relationship that we've built. And in Gus's own words, we love to tell our stories authentically. He actually has shared that when he's on board, he feels like a superstar. So were you there for that?
Yes, I was there.
Superstar.
Yeah, which he is.
He is. And you know, again, as Brandon mentioned, we do have 2 clinics on the road now, but that's because our model is designed to be both scalable and sustainable. Sustainability is really built into this approach through these strong partnerships with schools and community organizations. But then also because we have a diverse funding portfolio, whether it's individuals, corporations, foundations, or even a little bit of Medicaid reimbursement. But this layered approach is what allows us to continue to deliver care year over year.
And that moves us into our family and youth voice. This is something new for us. iThrive ReThrive is our parent and youth advisory board. The board is currently made up of 19 members with a core planning of 9 members. It is created to ensure community voices are woven into all programs to provide feedback directly from the families we serve in order to strengthen our services. What better way to get feedback to the families that we see on a daily basis, right? And so we formed this year, and so we're looking to grow this to help grow the organization.
Yes. And we thought we would wrap up our portion of the presentation with the same way we ended it, and that's with our kids. This is the Keener family, and when they first learned about that iThrive was visiting, their mom saw it as the perfect chance for her kids to receive the eye care they had been without after relocating and settling into St. Louis. 3 of her 4 kids ended up needing glasses, and their excitement was truly contagious. I think maybe you were here for this visit too, especially Angel.
Yeah.
And when she came off the clinic in her new glasses, her mom was literally brought to tears, and just the relief that was felt from that need being met. And this and all the other kiddos that we've talked about, and all of the other 40,000 kiddos that we've seen, is why we do what we do, so that every child in our community can get the vision care they deserve.
Yeah. Thank you for allowing us to present. Let's please open up for questions.
Well, I'm gonna start us off because you had mentioned but didn't talk in detail about it, and it was so impressive because when I was there the other day, we talked about it. Tell us a little bit, and I know it's still evolving, your electronic medical records.
Yeah, so this has been a custom-built system, and that is mainly because there was nothing out there that could do the things that we needed to do. Before this EMR system, we were using 12 different platforms from start to finish through the process. And so we know we needed to consolidate it. And so we've been on a 3-year-long journey. We still have a little bit ways to go. But basically from start to finish, all of that medical information is now stored in this system. So when our school partnership coordinators, the lead point of contact for iThrive, is out at the schools doing the vision screening, they can very quickly on their tablets enter in those results. They can see if we have a consent form on file, and they can hand the student the appropriate paperwork. From there, we get all those consents in, that all gets entered into the system. And because we have so many of the same families, we still take the time to update those medical records and what's on that consent form. And then from there, during the exam itself, the pretest data goes into the system. That kind of moves then into the exam room, where the entire exam is completed in the system. And then finally, that final prescription hops over into Brandon's lab, and then he knows exactly what prescription to make once the child has selected their frames. Additionally, we have the replacements integrated within the system. So when a replacement order comes in, that form speaks to our system, and it tells our internal optics coordinator, Bill, exactly what needs to be made, what color were the glasses the last time they made them, and all of that information. And then from there, we track shipping and even receipt of those packages. We are working right now, actually, on integrating the referral system within this EMR, and then from there we have a list of some other priorities. But the goal is that it is housed in this centralized system, so that it's not only stored safely, but we can very efficiently move through our process. And we can pull up, when we see Gus next year, we can pull up his records very easily from last year. We can look at his screening results. We can look and see if he had any referrals, all of that. Does that answer your question, Donna?
Yes, thank you. And you walked me through it the other day, and I knew people would be interested. I just want to congratulate you on tremendous work. As others have said, I mean, you're meeting the needs of so many children who otherwise wouldn't be getting, the vision care. So again, it's tremendous work, and I certainly hope you can continue to grow and expand and meet greater number of children's needs. One of the things, particularly since you were talking about your electronic records and your referral system, is because this population of children are underserved, it seems, have you consider, and I don't know, it might be an added burden to you, but the need to perhaps help to refer these children if they don't have a primary care home, where they receive other services that perhaps, and it might be something you're already doing, connecting them to such service, whether it's through the community health centers, or as you said, through WashU with the, for the surgery, but certainly WashU has primary care too, because it's, I think you're meeting such a big need for these kids, but at the same time, they have other both physical and mental health and behavioral health needs. And because you are trusted providers for them, it seems like it would be an opportunity to expand, the services.
Yeah, that's a great question. And yes, it is something that we have considered, and we have made movement towards that. So one thing I can think of offhand is something we haven't talked about, but we have quite a bit of patients that are diabetics. And so we have something called the Diabetes Communication Report, because as you know, anyone that's a diabetic especially needs that annual exam. And so we fill that out, and then we allow them to take that back to their primary care physician to try to ease that communication. But in addition, so because of the nature of most of our visits, where we're at schools and families aren't present, it does present some challenges. But where I have seen it work is, and this is more on an informal basis, but during the summer visits, during the community visits during the year, when we are, parents are bringing their kids to us, we can engage and chat with them about everything. And that's part of the model too, is we actually have space where parents can talk to us, and we bring in other services or other agencies to talk through what they're providing. So an example of this is we have a partnership with Delta Dental, and they come to these community visits and talk to parents about dental health and where where they will be located next, and hand out some toothbrushes. We also have a literacy partnership. There is an incredible organization here called Turn the Page, STL, and they have funded a project where they bring authors to each one of our visits, and the authors actually read their books and sometimes even pass out their books to kids and talk about the importance of literacy. So we really try to maximize that time we have with families on site, whether it's through those more formal things or just through informal conversations. I can think about a time actually during COVID where I met a family and just standing next to this woman, and I thought it was her child that went on board the clinic, but she quickly corrected me that it was her niece, but she had just recently taken guardianship because her mother had passed away. And we just, chatted, and it turns out that she was just so grateful, but specifically she said because now she can have her eyes and her teeth. And I didn't really get it at first, so I followed up, and she explained that because the eye exam was free, they could pay for the dental exam. And then naturally in that moment, I was like, but wait, you don't. And here's a resource for the dental exam. And then she was like, well, now she can get her hair done before school, which was a big deal. It was a middle schooler. And that's just like one example of a natural, authentic connection that happened. The other thing that we've intentionally built out, and this is our second year of this, is we have what we call ICU, and we love puns here, EYE. ICU, and it's a community health affair, and we bring in all different kind of providers, and the goal is exactly what your question was kind of getting down to, Marie, where we're building on the trusted relationships that we have. So we advertise this event throughout the end of the school year and throughout the beginning of the summer. And the goal was, even if kids had already seen us, come out to this event because we're bringing in our trusted partners so you can trust them too. And we do quite a bit of vetting and all of that, where we had, I believe it was 6 different mobile health clinics there that day. Dental, physicals, hearing, speech.
I think we have 2 demos, didn't we?
We had a couple different dentals. And then on top of that, just other community health resources, something like simple as like gun lock distribution, which is critical for our community, backpacks to go back to school, food, all of those things. And that was very impactful. This was our second year of doing it. We're planning to do it again and grow even bigger. You want to add anything to that?
I think you summed it all up.
That's fantastic. Thank you.
You're welcome. You're welcome.
Great question.
Yeah.
Bonnie.
Yeah. Wow. I'm glad kids get to choose their frames.
We are too.
Yeah.
We are too.
And I mean, seriously, I'm glad they get to choose
Yeah.
their frames. But my real question is sort of a follow-up to Marie's, because I don't hear a lot of partnership with public health here. I think that's kind of unfortunate, not that you haven't done it, but that this beautiful comprehensive program is going on and can go on. And this is the question, is it going on without, in spite of public health, meaning community health centers, meaning the State Department of Health, your local health department? And talk about getting primary care is a heavy lift. Getting public health on board is a heavy, heavy lift. And I just wonder if you feel comfortable, kind of, well, maybe I'm wrong. It just sounds like that there's not a lot of involvement of the public health sector that really should bear a major portion of responsibility. for
Yeah, and
advocacy here.
I can speak to the parts that I know, and yes, that invitation is there. And actually, the Department of Public Health did come to our health fair. I think they did blood lead testing and a couple
Good.
other things. But they don't, they'll come to support with other services. They don't necessarily support like our work in itself. And that is definitely an opportunity. I think with all nonprofits and federally qualified health centers in particular, like they're overburdened as well, and so there's not a lot of resources that they can rely on to connect back with us, but we also very intentionally stay in this one lane. Like we have a staff that includes many optical experts, Brandon included, obviously our optometrists and several others. We have experts in education. We have experts in social work. We have experts in nonprofit work. We have experts in the restaurant industry, which, believe it or not, is a very transferable skill to what we do every day on that clinic. And students just right out of college that are finishing their masters or in public health, and so we rely on that to build out this comprehensive program. And that's where I see the kind of the difference between us and what's happening in some of these federally qualified health centers. We're removing more of those barriers. We're going directly to the schools. The parents don't even have to come to that center to get services. They don't have to take more time off work. Additionally, we hear a lot about food deserts, but there's also healthcare deserts. And in particular, there's eye health deserts in right where we are sitting right now in North St. Louis.
Yeah.
If you know anything about St. Louis and the history of Del Mar Boulevard, it is significant. And services provided north of services, opportunities, homes, all of those things, education north of Del Mar is significantly less and intentionally designed to be less than those living south of Del Mar Boulevard. And so we know that within the space of North City, north of Del Mar, we are legit the only eye care provider in that area.
Yes.
So again, yes, we want to expand. We also want to do it in a sustainable way. As Brandon kind of mentioned, we're not expanding quite yet, but we do imagine expanding in the next maybe 4 years or so.
Yes.
Can I ask a question? And I'll show my ignorance here. Why is Missouri not requiring that schools conduct vision screening? And is that common among states anymore?
Well, I can
I've been gone too long.
I can chime in on that. Right now, we're at about 41 states that require vision screening that have regulations for school-age children. It's only about 27 to 30 for preschool. Some states, I will say, I've talked to the state school nurse consultant in Missouri. They have guidelines. So some states have guidelines, which of course is a recommendation.
Sure.
And I think when you've got strong support and guidelines versus regulations, a lot of the screenings do get done. I can't speak exactly. Some states have overturned their vision screening regulations. Another state has done that since we published our list. Tennessee has done that. So some of it is, there's more of a movement now toward, I'm trying to be really diplomatic in how I say this, kind of the parent consent. Well, you live in Florida, so what do I have to tell you, Bonnie? But no, around consent for health services. So I think that there is some concern, which would be a whole different conversation. But so I'm not saying that's what's happening in Missouri, but we know that that is happening around the country, and that is presenting huge challenges both to programs like iThrive, school nurses. I know that Lynn Meadows is here. She's the district director for Fulton County on our advisory committee. And so I'm not sure exactly what's happening in Georgia, but that is a huge, huge, huge challenge for school nurses and school-based health services right now. So I don't know if that answered you, but more states than not do have regulations. Also, there are a couple states, Alabama, where the government puts money in for vision screening. So they hire companies that go in and do all the screening and the case management. So you can't just look at the regulations. There's other inputs in state. So I just want to, okay. Kira had her hand up, and Kira is our executive vice president, used to have my job. So children's vision advocate at Prevent Blindness.
Oh, thank you for that presentation. Wonderful efforts that you're doing. And Bonnie, you asked my question around, the changes and the requirements and the systems and the impact. So, but the other question I had is, as you're speaking to families, maybe at your community fairs, or you're communicating with them through, forums and that sort of thing, I have to imagine you find that kids don't have access to care, have parents who don't have access to care. So how do you deal with or support families, parents that may also be looking for eye care? Like I noticed the Kinner family, I think it was, the mom had glasses as well. Just wondering how old her glasses were. And so what's the access for the parents who are taking the kids everywhere and helping them experience their world?
Yeah, that's a great question. And we refer out to the trusted partners that we have. Again, this goes back to that health desert in particular and related to eye health. There is one fixed clinic through SLU that is available for adults, but it is open only limited days and very difficult to get into. We actually originally did provide services to adults. And in 2013, when we launched our first mobile vision clinic, specifically towards children, and then in 2016, we decided to narrow the scope intentionally to kids, because for a lot of different reasons. When you're doing a lot of different things, sometimes quality decreases. And so we wanted to bring in all of this expertise related to kids and really stay in this lane. A very common thing that happens in nonprofits is a little bit of what's called mission creep, where yes, there's a need here, there's this, there's that, but this is our lane. And so we and the board and the staff at the time, intentionally decided that kids and eye health was our lane, and then rely on those other partners to be able to say, this is a place you can go, this is a place you can go. But unfortunately, there's not a lot of them.
Yeah, I appreciate that, trying to avoid the mission creep. So I'm not going to say if you want to work with us to provide access to some eyeglasses for adults, but those partners you refer to, if they want to collaborate with us to make sure they have the right kind of resources they need for access to eyeglasses, let them know.
We would.
We coordinate with them and make sure that population is supported as well.
Yeah.
So thank you.
Something else I was just thinking of that VSP does on top of the frames is they also donate certificates that we can distribute to adults. So this is more common in those summer visits or open community visits, where parents come and they're like, can you see us too? And we're like, well, no, but here's a certificate. You can take this to any VSP provider. I'm sure you guys know about this, and get an exam. And so we are able to do that, which, isn't as convenient as what we do, but it's still at least some sort of a resource.
Yes.
No, I appreciate that.
Thank you. Stacy, did you have a question?
I just wanted to ask, one of the things I thought that really made your application stand out was how your model for sustainability, and the fact that you were able to pull resources and support from a lot of different places. I just wondered historically if you were built that way from the ground up, or if this is something that you came to over time to meet that need.
This has definitely been something that's changed over time, and more recently in the last 8 years or so. We know the importance of diversifying our funding portfolio and not relying on one single donor, especially as we've grown in budget over the last 8-9 years in particular. And so that's very intentional. We have an amazing development team that does that work and sources those opportunities, and most importantly, leads the stewardship of each person and each supporter, whether they're they're donating monetarily, whether they're donating in kind gifts, whether they're donating their time, it's all valuable. And actually the in-kind donations that we get, Brandon mentioned VSP, we also, who donates all of our frames. And these aren't just like old frames
These are
or
brand-
used frames, brand new and brand name. We also have all of our prescription lenses donated through Essler and Midland Optical. And then we also have cases donated from Amcon, which is a local St. Louis company that does a lot of great work in the optical world as well. So those, our total revenue from an in-kind perspective is $250,000 a year or more. So it really, it allows us to be a lot more efficient with our dollars. All of those things. And the same thing with our volunteer. We've just recently really expanded and grown our volunteer program, and looking at all the different ways that volunteers can help us while also, again, maintaining this really high level of service. And that's equally important. So, and of course, our board of directors are all volunteers and come again with a wealth of experience and knowledge, and they're able. It's truly incredible. Like when we might need support on something optical related, we can reach out
Physical
to.
appointments, things of that nature.
Yep. And we kind of have a place to go on the board or a person to go to on the board for kind of anything that might pop up.
Yes.
Does that answer your question?
Thank you, Ms. Stacy.
Thank you. I think Marie has a question.
Yep, we have time for about one quick question and one quick answer.
Well, it's not actually a question because again, the more I listen to you, it's just you have such a wonderful model, and particularly for a nonprofit. I mean, is how you're, avoiding mission creep and relying on partners and staying true to your mission. I think there's you could teach so many, groups out there. And I don't know if you have that opportunity to, because you guys definitely flourishing and could be emulated in whatever, discipline. But just a quick thought as you're talking about expanding perhaps volunteers and partners is again, going back to, for those health professional training programs. So in fact, whether it's Walsh U or St. Louis University, I think this is where medical students would be invaluable. They could learn so much from participating in your program, volunteering, and it would be because they can learn about community, they can learn about the underserved, and then the need for collaborating with other disciplines. So just a thought, if there's anybody on your board potentially can make that connection, or anybody else, because I think it would be very worthwhile for those trainees.
Yeah, it actually is. It's something that we've already been connected with.
Yes.
And because this is so new, we're sometimes I have to make the unpopular decision to say this is a great idea, but not right now. And that has been the case when it comes to some medical students that have reached out. And that's just because this volunteer program is still in its infancy, maybe approaching toddlerhood here pretty soon. And because our work is hard, right? We have long, hard days. Brandon was out on the clinic this morning, drove it back. He's here tonight. We have other team members that have done the same. We have to, from that sustainability perspective, it's my job and our new director of HR's job to protect our people and to make sure that their workload is sustainable. And so, yes, we would love to do that over time. We're just not quite ready for it yet.
Thank you all. All right, and Dr. Coulter is going to wrap us up.
Okay. Well, as we bring this wonderful evening to a close, I want to extend our sincere thanks to everyone who joined us for the 2025 Bonnie Strickland Awards ceremony. To our award winner, congratulations on your outstanding accomplishments and the inspiration you bring to our national community. A heartfelt thank you to the reviewers and staff whose hard work and dedication made tonight possible. And our collective passion and excellence remind us why we celebrate this event each year. Thank you again and have a wonderful evening.
Thanks,
Thank
everybody.
you. Thank you so much. What a wonderful job. What a wonderful
Thank you.
program.
Thank you,
Thank
guys.
you.
Thank
Kate and
you.
Brandon, don't forget to take a picture with the award and send it to us.
Yes,
We
ma'am.
will.
Yes,
We will.
ma'am.